Carla Atherton, Director of the Healthy Family Formula and host and producer of the Children's Health Summit 4. In response to the rapid rise in conditions such as autism, cancer, ADHD, GI distress, anxiety, depression, asthma, skin conditions, learning disabilities, and autoimmunity, the topic of this year's summit is preventing and reversing childhood chronic illness. And today I'm very excited to be interviewing this session's speaker, Dr. Ty Vincent. Ty Vincent, MD, is an integrative physician in practice since 2005. He completed medical school through the University of Washington and a residency in family medicine in Anchorage, Alaska. Dr. Vincent has gained additional training in acupuncture, Chinese medicine, environmental medicine, allergy and immunology, bioidentical hormone therapy, chelation therapy, hyperbaric medicine, integrative cancer therapy, Reiki, and nutritional medicine. Holy cow. Dr. Vincent has lectured nationally many times on the subjects of bioidentical hormone therapies, vitamin D, and low-dose immunotherapy. In 2014, Dr. Vincent developed immune therapy techniques for treating chronic Lyme disease and a large number of autoimmune diseases with a high degree of success and safety. Dr. Vincent is married with 9 children and currently resides in Kailua, Kona, Hawaii. He works from home, helping chronically ill people around the world via telemedicine consultation and sending low-dose immunotherapy to their homes. Welcome, Dr. Vincent.
Thank you. Do we still have time left?
Yeah, no, we're done. You know, that's all we need to know. That's all we need to know. No, I mean, really, but it's really good to know though, because, you know, sometimes I don't, yeah, it's sometimes, you know, sometimes they go long, but I think that it's really good to know what your background is, because you come from a whole bunch of different disciplines and different, you know, trainings, and really find that what we're going to be talking about today, low-dose immunotherapy, to be highly effective, even though you have all these different tools and sort of like, you know, everything sort of comes together. So I think that's really important to know. And I just wanted to say really quick before I ask my first question, Dr. Vincent, that I discovered you in a podcast by the Better Health Guy. And that was, you know, a few months ago, and I listened to it, and I was away, for, you know, for like medical stuff with a family member. And I was just blown away, because everything, I mean, I really respect and use homeopathy a lot with my clients and my own family, and, you know, I recommend it. I think it's really great. It's not homeopathy that you're doing per se, but it's along the same principles as homeopathy. So it really spoke to me. And as well as, you know, your description of the immune system and everything that we're going to get into today. So I'm very excited about it. I was telling you just before this, I'm planning to train in this. So, you know, by the time this airs, I'll be well on my way. So thanks for being here, Dr. Vincent. I really appreciate you lending your voice and some tools for parents listening. My pleasure. Okay.
This fits right in.
I think so too. I think it's amazing. So, okay. So first question, what is LDI?
So the history, you have to understand the history some. There was a doctor in London in the end of the 1950s, right around 1960, who was an allergist, conventional doctor, allergist, and he discovered somehow that you could give very diluted concentrations of allergens to people in large numbers together and take away their allergies, basically by promoting tolerance. Like in a single word, what we do with that treatment that was called EPD originally, and then LDA here in the United States, and now what I call LDI, what we do with this technique is restore immunological tolerance. That is the key fundamental word, which is, it's important to realize that that's potentially somewhat different from the concept of desensitization. Mm-hmm. Desensitization is also what we're achieving, but it's from a position of restoring immune tolerance rather than some kind of forceful adaptation phenomenon that you get with conventional allergy shots, for example, because that's another method of desensitization that doesn't really work by promoting natural mechanisms of immunological tolerance. Mm-hmm. So, I mean, that's a simplistic way to look at it. How it works, nobody understands. I mean, you mentioned homeopathy. It's very similar in that we don't understand how homeopathy works. It's just been a described and observed phenomenon that if you give a very diluted amount of a certain thing that tends to cause certain symptoms, you can actually get the opposite to occur. You can negate those symptoms. You can get the body to have an adaptive and a healing response, so to speak, so that the symptoms go away instead of be created. And what we're doing with this application of this concept is promoting immunological tolerance, so by which we can get any immunological inflammatory process in the body to stop, basically. And you ran off a whole litany of childhood illness categories that are rising in the last 20 or 30 years dramatically, frighteningly so. And I think everything you listed, it went by pretty fast, but I think everything you listed, I have found has a very strong immunological component to it.
Yeah.
So as I tried all those things you listed in my resume or my past training, that was my search for finding answers for chronically sick people, children and adults alike. And everything you learn applies to some people, not all. As I've gone through all these different techniques and skill sets, I've found that manipulating the immune system yields the best results for the most people with the widest array of problems. And so this is all I do now, basically, is immunotherapy. So LDI stands for low dose immunotherapy. I'm not sure that's a great name, but it's an adaptation of LDA, which was low dose allergy therapy. And that was something that I built upon very heavily. And so I gave it a name that's similar to that, just to maintain a certain amount of continuity.
Right. Okay. So we've got all these different ways of dealing with all of those things I rattled off, right? And we kind of know what the usual suspects are. Like, it could be infection, could be like toxicity from the environment, reactivity from foods. And so often people's, like, the way that we go about it is to either eradicate the infection, to get rid of the toxins, to, not eat the food. So how does your do you do that in conjunction with what you're doing, or how is LDI maybe superior to it, or an adjunct therapy, or something instead of? Can you explain that?
It would be the last thing you mentioned, the instead of idea. So if you identify that a child has eczema because they're allergic to corn, for example, it's possible to make the child's eczema go away by strictly avoiding corn. Any families out there that have tried to do that with a child knows that is the worst nightmare you could possibly have. That is the worst food to try and avoid. Yeah, trying to avoid corn is so hard in our modern life because it's a constituent in so many things that we use that aren't even food substances, and other food products. Like an infant that's allergic to corn can't tolerate the breast milk from their mom if their mom ate corn-fed beef, for example. It transmits through multiple chains in the links in the food chain, because corn can modify the valence of carbon, basically. So instead of having to avoid the food or the chemicals that you're allergic to, or the animals, plants, mold that you have severe allergies to, LDI enables you to live with those things in your daily environment, have constant exposure to them with no illness, with no symptoms.
Yeah.
So you don't have to do all that. In regard to the infection idea, that's probably the most common lecture I give in the recent years, is to explain to people that many of the things that we have come to believe are chronic infections are actually not. And I'll use Lyme disease as a common example. Or pandas, we're dealing with children in this topic. So pandas, the pediatric, it's even got the word autoimmune in the name. Yep. Pediatric autoimmune neuropsych disorder associated with strep, right? It's not called pediatric infectious disease associated with strep. That's strep throat. So this autoimmune process that ensues in some children after having had recurring strep, that's the typical scenario, is not an infection. It's not even labeled as such, but it's treated like one because people didn't really have another tool, right? So they give the child antibiotics for months or years, and you do in fact often see some mitigation of symptoms or elimination of symptoms, but antibiotics have consequences, especially with long-term use. And there's often a lot of sort of, diminishing returns over time with that approach. And then the kid ends up on IVIG, which you got to basically sell your house to pay for IVIG. So what you can do instead is you can restore appropriate normal immune tolerance for streptococcus, and then the pandas problem goes away. And you don't have to treat it like an infection, because it's not. The reason that treating pandas, Lyme disease, acne is another autoimmune process that we blame on a bacterial infection in the skin, and it's not. It's an immune reaction to bacteria that everybody has. Herpes simplex outbreaks, like cold sores, that's actually an immune response, not an infectious outbreak. So rather than using some antimicrobial strategy to try to get rid of the organism or suppress the antigen exposure, basically, it's just like the corn analogy. If you don't eat corn, your symptoms will go away. Well, if you suppress the organism down in your body low enough, below that person's threshold of response, you can get symptom alleviation, like in Lyme disease and whatnot. But then you got to stay on antibiotics for months or years and hope that eventually the immune system forgets that it ever had a problem with the item. But the immune system has a very stubborn long-term memory. So instead, you can just restore normal immune tolerance for that organism and get rid of the disease process that way. And it's a lot safer, it's a lot more effective, it's a lot less expensive, and it has no other collateral damage that you're going to do to the person's ecosystem by using an antimicrobial strategy.
Okay, so this is a question I've been dying to ask you, because everything I listen to, I'm like, yes, get it. And you have a lot of lectures about the immune system, and you know, and about all these particular conditions and how to apply, you know, and use LDI. But then I think, okay, when we're talking about infection, so are you saying that? I mean, so the question would be, okay, it's not like suppression, I guess. So if you think about this as being a suppression of the immune system, or like where the immune system isn't hyper responding, right? Because that's where the illness, like that's when people get symptoms. So let's say we do that. Is there this potential that like a pathogen can get out of control? Like I'm thinking more, I mean, you know, is there like a place where the body's not actually handling it, and the infection's still getting worse, and you know, like can that happen? And especially I'm thinking about parasitical infection, right? Like you don't want, we have some parasites, but we don't want like this huge tapeworm, and then our body's just like, nah, it's fine. You know, like what do you see to that, right?
So you have to, and this has been part of my own education in this over the last 6 or 7 years since I've used this tool so heavily, is learning what things are actually true infections and which ones are not.
Okay.
Our Western mentality about illness has evolved a lot over the last 1,000 years or so, right? We used to think that God did it to us, you know, like we still use the term stroke. If you have a stroke, well, that comes from ancient Greece. People thought Zeus hit you with a lightning bolt. Now we know it's a blood clot in your brain. Okay, we've come a long way in our level of understanding pathogenesis of disease. You know, at some point in time, we thought that a lot of illnesses were evil spirits or evil humors or some kind of metaphysical thing. Everything was metaphysical, right? Like tuberculosis was called consumption, you know, because your body just started to consume itself and waste away. You cough up blood and then you die. And then we got microscopes, okay? So we got microscopes, and people saw this whole new world that's been in us and on us and around us all this time. And now suddenly all of our problems are based on germs, right? Oh, it's all infection. And then we start handing out penicillin to everybody for everything, and we create a big problem with drug resistance. That's another topic. But now, in the last decade, it's very common that we're learning about the importance of the human microbiome. You know, we take probiotics for all these different things, and we understand that the organisms that live in you make up 90% of the cell count that is you. You're 90% germs and only 10% human. There's actually a fantastic book on the subject that's called 10% Human, if anybody out there wants to read it. So we need to evolve our understanding of illness away from the whole I have an infection idea, and understand that the mechanism of a lot of these illnesses is not the fact that the organism is present in the body. It's the fact that your body is not tolerating it appropriately. So I would say like syphilis, okay? Let's say syphilis is a true infection. Let's say that everyone who picks up Treponema pallidum, the spirochete that causes syphilis, let's say everybody who gets infected with that gets a bad disease, with very rare exception. And if you treat it with penicillin, they're cured in 2 weeks and life goes on. That's how infection manifests, okay? And that's an organism that doesn't belong in the human body. It's not part of our ecosystem. Then let's look at something like a bladder infection. Women are prone to those. Some children are prone to those. 80% of bladder infections are caused by E. coli, right? Well, how many people carry E. coli in their body? Everybody. 100% of human beings carry E. coli in their colon. It lives in your colon just fine. It's only an infection if it gets in your bladder, which is supposed to be basically sterile, right? So a lot of our common infections we deal with actually involve what I refer to as trespassing, basically microbial trespassing. It's a germ that lives somewhere in your body all the time, and it got in through an opportunistic, opening somewhere or opportunity, and it got somewhere it doesn't belong, like pneumonia. Pneumonia is caused by germs that live naturally in the nose and throat. They just got into your lung, and they're not supposed to be in that tissue. Meningitis, so true infections like that we see commonly in medicine. And again, you can treat that person with an antibiotic for a week, 2 weeks, and they're cured, and life goes on. They don't have a chronic illness associated with that. In virtually every case where something causes a chronic illness situation and it's thought to be blamed on a microorganism, it's not an infection. That mechanism that I described is not what's going on. It's actually an immunological response problem. There are some exceptions. And that gets back to the other part of your question is like, well, will you lower your defenses and allow infections to overwhelm people by using LDI, right? Back to the real question. And the answer is no, because all we're doing with LDI is very specifically restoring tolerance to single things or to certain specific organisms. We're not lowering the immune system's defense in any general way. And in fact, we're not lowering the immune system's defense at all. There's an important line and distinction. When I do lectures on this, I draw this like 4-box diagram, which is very simplistic. But the two general things your immune system does as a job are defense and tolerance. And they are mutually exclusive concepts. They have nothing to do with one another. Different cell types, different cytokines and signals, different inflammatory markers regulate these two different functions of the immune system. So dealing with the tolerance aspect of things is just like taking away allergies, right? Like we're making you not allergic to dogs or not allergic to peanuts. That doesn't leave you susceptible to a peanut infection, right? Which isn't a real thing. And so if you restore immune tolerance, normal tolerance to Candida is my best example for this discussion. You will see a lot of people who have very bad, persistent inflammatory reactions to Candida because Candida lives in everybody. It's normal flora. You'll never get rid of it, no matter how hard you try. And it is also a potentially true pathogen. And we know that because if you immunosuppress someone, like they get AIDS, they get HIV, they get AIDS syndrome, they will have Candida infections coming out of every orifice and all over their skin, and it can kill them. If you put somebody on chemotherapy for cancer, they can get horrible Candida infections and whatnot. It's a pathogen, and we have to live with it all the time in our bodies, right? So that's one Candida problem, is the potential for infection. And if you lower your defenses, you will get yeast infections. Then there's this whole cadre of people that have chronic illnesses that are an inflammatory response against Candida that's inappropriate and hyperreactive. And so it's more like an allergy. It's an allergy rather than an infection, if you think about it that way. And they often get diagnosed with things like irritable bowel syndrome, chronic fatigue syndrome, fibromyalgia syndrome, all of these made up terms for people that have a lot of chronic systemic inflammation and we don't know why. A lot of those people are sensitive to yeast. And I know that because about a decade ago, I came up with a mixture of yeast organisms and I started using what I now call LDI and desensitizing those people to yeast, and all their symptoms would go away. And so it's probably yeast is the most common microorganism mixture that I use in LDI just across the board. And I've done it for 10 years now. And I've never once encountered anybody who started getting yeast infections because we restored immune tolerance to Candida. So it just doesn't happen. And I mean, it's a long way to get to the explanation, but it just is not a concern because we're not doing anything to alter the normal defensive mechanisms of the human immune system, which is all different cell types. And it has nothing to do with tolerance, basically.
Okay. So so if you've got like a raging yeast infection or all that stuff and you use LDI, that's, if you're wrong, if you're wrong about it being chronic, if it actually is an active infection, like a true infection, is that a problem?
Yeah. No, it's not going to work. So that's a problem, but it's not going to make it any worse. Like if you took a course of antibiotics, okay, the typical woman, if they take a 10-day course of antibiotics for a dental infection, let's say, and then you get a horrible vaginal yeast infection, you need an antifungal. Okay, you need to take fluconazole or whatever, and you need to clear it up and get the normal, get the level of candida in that body compartment back down to normal, and then you're fine. If you tried to use LDI for that, you'll get no results. It basically won't help you.
Would you use?
But if you have a woman,
no, go ahead.
Say that. Let's say, but if you have a woman who has chronic vaginitis, because I've seen a lot of these women, they have like, fatigue or say interstitial cystitis, which often goes along with this, endometriosis. Those are all situations that usually involve a chronic immune response to yeast. Endometriosis does 100% of the time. Interstitial cystitis, I would say 75% of the time, the woman has an immune intolerance or an allergy to yeast. And then chronic vaginitis is 90 plus % of the time they have an allergy to yeast. They'll take fluconazole or some antifungal drug and they'll feel partially better or maybe get all the way better while they're taking it. And then when they stop taking it, their symptoms come raging back. Cycle after cycle after cycle. That's the pattern. That's how you know that that person actually has an immune response problem and not an infection. So it's all determined by the story and the pattern that you see with that.
Okay.
There is no test that's going to tell you the answer, unfortunately.
Okay.
And I would contrast that with Lyme disease. So with Lyme disease, when symptoms are present at all, even like you get a tick bite, you get the erythema migrans rash, you have a fever and muscle pain and the whole bit, right? That's not an infection either. That's actually an immune response condition from day one. And I say that and people are like, no way, that's not possible. But that's been proven by using LDI for the people in that situation, and all the symptoms will stop. How come people get bitten by ticks and nothing happens? Right? I mean, because the only time you get the illness symptoms in what we call Lyme disease is if you have an immune reaction to the organism. Okay. And I know we're talking about pediatric stuff and people are like, well, my kids don't get Lyme disease very often. But I will tell you, there are a lot of chronic inflammatory illness conditions in kids. Most of them are neuropsychiatric, involve the brain in some way, that are actually an immune response to the Lyme organisms, to Borrelia, maybe Babesia, Bartonella. And I would say most notably on that list is autism spectrum issues. Like most of the kids with autism spectrum diagnoses, at least some of their symptoms are related to an immune reaction to Borrelia or some other organism in that cohort. And I know that because I use that antigen mixture in these kids all the time, and I see major improvements in them as a result. Okay. Including my own son, one of my sons. I have 9 kids, like you said, but one of my sons had borderline autism spectrum symptoms significantly. We had to delay him getting into kindergarten a year because he just couldn't perform in preschool and do any of the testing they wanted him to do. He just wouldn't perform. He had speech delay. He was real quirky, different things, and I started giving him the Lyme LDI mix, and his teacher said within a week of giving him his dose, his teacher said that he did all the testing correctly and he was ready for kindergarten, overnight. Yeah. I mean, it's a really big deal. I still give him his dose. We can tell when it wears off. He starts to get very frustrated. He can't make a sentence. He can't formulate his thoughts. He can't focus on anything. It's like night and day. Then we give him his Lyme LDI dose, and the next day he's totally fine. It's really a very powerful thing.
Yeah. And so then that actually brings up another question. So you're talking about giving another dose. So this is something that you have to do, kind of educate the immune system over and over again. It's like not a one-shot deal.
Right. Like I said, the immune system has a very long memory. Has a very stubborn long-term memory, which is the reason vaccination works. You can give a child the varicella vaccine one time. Now they're suggesting, a booster, or you can take the measles vaccine and one time, and you'll probably have immunity for your entire life, as long as it's delayed past age 5. See, the mistake they're making with a lot of vaccines is they give them too early. Mm-hmm. So if you wait till the person has a matured immune system, like if you got the measles vaccine when you're 15, you'll be immune to measles your whole life from that one exposure. And it's similar with allergy or inflammatory responses. I mean, that's a double-edged sword. The immune system requires repeated reminders to be tolerant. What people don't realize fundamentally about the immune system is that tolerance is a learned phenomena. It is not the default programming. We aren't born just tolerating and accepting everything in the world until we learn otherwise and we get burned. And it's not like how we treat people. You're born thinking that everybody's cool until people wrong you a few times, and then you start to get a little leery, right? A little gun shy, like people are bad. Our immune system has to be specifically taught that everything is okay, and that there's only really a pretty select small subset of things in the world that are potentially harmful. So when that tolerance process doesn't work properly, you end up with people that have a lot of aberrant, unnecessary immune reactions to things that are potentially devastating. I mean, allergies can kill people. Mm-hmm. Kid can eat a peanut and drop dead. That's the extreme example, but it's also possible that a child who's allergic to milk just has chronic eczema, constipation, asthma symptoms, recurring ear infections as a toddler, and since we're talking about kids, it's something that's important for people to understand in terms of allergy and immune response is that it can change throughout development and growth.
Yeah.
So with dairy allergy, it's very common that a child will be colicky at birth, spit up a lot, and then they develop constipation problems, and then they develop eczema later on. And then as an older kid, they might get asthma, might get migraines as a teenager. And one illness will trade off for the other, like a relay race. Mm-hmm. And it's all milk allergy the whole way through. Mm-hmm. But instead you're talking to gastroenterologists early on, and then you're talking to dermatologists, and then you're talking to pulmonologists. You get all these different ologists on board, none of whom understand what's going on, because they're only focusing on the disease symptoms and the diagnosis.
Yeah.
But when you start to look at chronic illness problems in terms of reactivity to things and mechanistically immune inflammation things, you start to realize, like you said earlier, that there's probably a few common things that cause all this other stuff that we see. And the immune system mediates a lot of it. When the immune system gets involved, you can have 20 different illnesses from the same single antigen.
Yep. Yeah, exactly. Well, that's totally what happens. And so, okay, so again, I'm going to come back to the pandas kids, okay, or Lyme, or, what an infectious agent creating some kind of autoimmune response or neural inflammation. And so, so you're saying that there's this memory, this is like an allergic reaction if it becomes like a chronic thing. So, but there is this point, at the beginning where there is strep infection, like they will get sick and they have strep, and then hopefully the immune system will handle it. There's this theory also that the immune system becomes overburdened and then actually can't handle it, and that's why the kids end up really sick with it, and they end up with an autoimmune condition. And so are you saying, so if you use LDI in the case of pandas, do you ever so is there a step-by-step thing, like you deal with the infection first and then you do LDI to make sure there's no reactivity or flare-ups or that kind of thing? Like, is there anything that you would do like that? Or do you think that the immune system handles the strep, and then after the week or two, then it's really just a matter of reactivity? Like, do you ever use both is what I'm saying?
The short answer to that is no.
Okay.
So the infection stops after strep throat symptoms have ended. So
okay.
the infection you get with Streptococcus pyogenes is strep throat, swollen inflamed tonsils, horrible sore throat, fever, stomach upset, the whole bit. Mm-hmm. If you get anything beyond that, you have an immune response symptom. Mm-hmm. So if they end up with the neuropsychiatric stuff, the OCD, the tics, what have you, the rage, the behavioral, issues that come with that, those are not infection-related symptoms. They are purely always immune response symptoms. Mm-hmm. So You do have to treat the initial infection with antibiotics because strep throat can evolve into, rheumatic fever if you don't control it early enough. You can get peritonsillar abscesses. I mean, these are the reasons to treat the initial infection with antibiotics, right? To hopefully prevent the autoimmune problems in the first place. Mm-hmm. Streptococcus in particular is known to cause at least 4 completely different immunological syndromes. Rheumatic fever being the classic, pandas being one, a form of psoriasis called guttate psoriasis, which is almost always strep associated, and then glomerulonephritis, so kidney inflammation.
Okay.
And there's all these different body systems, right, triggered by one organism, and it's all mediated through the immune system. So the symptoms you get in any of those directions are not infection symptoms. They're always immune symptoms. And the real kicker here is even if you successfully get rid of the organism with antibiotics, you do not usually get rid of the autoimmune process. Mm-hmm. You have to also turn off the switch and restore tolerance to the immune system for the organism to see the problem go away. Mm-hmm. And that became very obvious to me when I treated a couple cases of guttate psoriasis, which, like I said, is associated with strep. I had 2 young men that had it. One had strep in his throat at the time I cultured him, and he was carrying strep pyogenes. I gave him penicillin, got rid of the strep, and his rash didn't go away at all. He'd had his rash for 4 years. So then I gave him, I used the throat swab that I gathered from him himself, and I made an LDI antigen out of it, which I call autologous LDI. And I gave him a dose of that, and his rash went away completely in a week, the rash he'd had for 4 years. Mm-hmm. So treating it like an infection is a failure, usually, when it becomes the immune response condition. You have to shut off the immune signaling. And even if the organism is no longer there in the body, you can still have the immunological process going on, which is a real drag. When you're trying to treat things as an infection, that's one of the reasons that it often fails, is because even if you successfully eradicate the organism, it doesn't fix it with certain things.
Well, it makes me think of mold too, like mold illness. Some people get so sick and they can clean up their house and they're just and they're still sick, and then they can't leave their house because there's mold everywhere. They're just hyper responsive, hyper reactive. I mean, I even saw a woman that I was at a conference with, and she had to put little filters on her nostrils so she couldn't breathe in the mold, right? It was so severe that she would have nosebleeds, and it was horrible. So that's where I can see another application of this, right? Is with mold illness, right? Yeah. So so what other thing? Go ahead, Ty.
Well, just briefly, the mold issue is 2 separate issues as well. Just like we're talking about microorganisms, and you can either have an infection or you can have an immune response allergy problem. With mold, you can have toxicity. Yes. So you can have really high burden of mycotoxins because you lived in a house that was just infested with Stachybotrys or whatnot for 10 years. You can have toxicity. You can also have allergy to mold, and they have to be treated completely differently. Yeah. The way you described that woman who notices when she's exposed to mold, she immediately gets symptomatic, that's allergy. And that phenomenon we can treat with a very high degree of success with LDI. But the toxicity problem, like if somebody has chronic symptoms, neurological stuff and whatnot, heart palpitations, dizziness, fatigue, that's caused by a high body burden of toxins, they have to detox that. They have to get that out of their body in order to fix that problem. And I have to go through this with people a lot. They'll tell me, I have a mold illness, can you fix me? And I have to explain to them, I can fix the allergy part, but the toxicity part is a whole separate issue. What do you have? And I got to tease that apart for people and see if they only have one or the other, or if they have both. Yeah.
Yeah, and that's exactly what I was thinking when I was asking you that question about pandas. Do you ever do both? And in this situation with mold, there are 2 different problems there. So you need to rid the body of the actual, antigen, and then you also need to calm that reactivity. Yeah. Okay. Good. Okay, that clarifies a lot. So what about what else? Is that right? Yeah.
Yeah, but with so in terms of pandas, it's only an antigen. There's not a toxin. Basically, panda symptoms don't have a basis in the organism itself. Presumably, you've already treated the kid's original strep throat, and they don't still have strep. But you will notice, like the parents will notice that anytime their kid gets exposed to strep, their symptoms go through the roof, right?
Yeah.
And that's a pretty typical pattern. And they don't even have to get the infection back. Just the exposure, or the reminder to their immune system, it's like waving at the immune system and mocking it. Hey, remember me? You hate me. And then the immune system goes ballistic just because it saw strep around the corner. It's all immune response. But I do frequently, when these kids flare up, I tell them they better go send the kid for a throat culture, because if they have picked up strep again, that needs to be cleared up with antibiotics.
Yeah.
So yeah, in this case, if they get strep again, they need to treat it with antibiotics and get rid of it. You do have to do that. But all the chronic stuff that ensues has to be treated immunologically.
Okay, got it. Okay, so you also mentioned peanuts. Like, are you using this quite a bit for peanut allergies? Because like you said, some of these allergies are life-threatening, lifelong, always having to worry about it. So, I mean, I would think that would be a more careful process when you're, if you're reintroducing anything like a peanut and the child has an anaphylactic, reaction to it. So yeah, are you using this for severe allergies like that?
Yes, with very high degree of success. And that's a good topic, because we're talking to children, parents with children. Food allergy is an incredibly common problem now, and some of them have life-threatening allergy reactions, and some of them develop so many allergies that the parents will be like, I can only feed him 5 foods, and his nutrition is terrible as a result. So the thing about using LDI for allergies is that it requires that you test it. So if a kid is allergic to peanuts and it's a life-threatening allergy, it's frustrating if that's the only kind of food allergy reaction they have is something scary, life-threatening. There isn't any food that you could safely test their response to after each dose, because it's not a one-size-fits-all dosing strategy. It's individualized. So we have to give the kid a dose of the food mixture, and then the parents have to do some kind of test challenge on the kid a week later and see if their reaction has gone away.
Yeah.
So when you have something like an anaphylactic reaction to peanut or dairy or something, most of those kids, not all, but most of them will also have a skin reaction.
Yeah.
So what I have the parents do is I say, put some peanut butter on their foot or the middle of their back, somewhere where they're not going to touch it, and rub their mouth or their eyes with it. We hope that they have a positive skin response also to contact. Most of the time they do. So like, cornstarch or peanut butter or milk or something that they have a severe reaction to. If you've got a skin reaction, that's a goldmine opportunity right there. Yeah. So what we do is we have the parents carefully analyze what the kid's baseline reaction is. And the parents that are really good at this will say, okay, I put, this one mom, I can tell you exactly what she does. She's like, I soak like a paper towel in milk, and then I just wipe his cheek with it really fast. And she's like, within 30 seconds, he started to get redness and hives. Yeah. And so I washed it off with soap and water, and it took an hour for the hives to go away. So that was our baseline data. And then we start giving him progressively stronger doses. And at one point, she's like, well, this time I wiped his, face with the milk, and it took 10 minutes for for redness to show up, and it wasn't even hives. And then I washed it off, and it went away in 10 minutes. And I'm like, okay, well, there's still a milder reaction, but it's not perfect. So then we just tweak the dose a little bit. You just kind of gradually increase the dose until there's literally no reaction at all on the skin. And then you feel like you can safely let the kid have a tiny little dab of it on their lip, or you just approximate it, and gradually more and more. But you can completely eliminate life-threatening food allergies with this technique with definitely 95% success or better. I can't even really think of too many failures. And usually it's because people just didn't want to try, didn't want to keep trying. But it works really well. It's just in those situations where there's a potentially lethal outcome, you have to be very careful. Yeah. Sometimes kids have an airborne reaction, like to corn. They can't go to a movie theater. They can't even walk by, the carnival or whatever. They start to get itchy eyes and wheezing. Well, you can use that as your exposure. You say, okay, well, take the corn dose. I found that treating a lot of the corn allergic kids with corn by itself works better than trying to use the whole mixture.
Okay.
And say, take the corn dose and then walk by the movie theater, and just poke your head in, take a deep breath and go, oh, yep, my eyes are burning and I'm starting to sneeze, and then run away.
Yeah.
And that's your test.
Yeah.
You look for something that's reasonably safe that's going to give you the answer.
Yeah. And I think about another application too, are pets, right? Because the kids love their pets, and they're all, having to take Benadryl and all kinds of other things just so they can live in their home with their pets, and they become part of the family. We have 5 cats. We have way too many cats, but and that wasn't my fault, by the way. So I mean, and you're not wanting to get rid of them. You're wanting to, live with them. So I could think this as being a very good application, of LDI as well. Yeah. Yeah.
It works great for that too. A lot of kids with severe asthma, because probably the worst, most pervasive and difficult to manage airborne allergy is dust mites.
Yeah.
Like some kids, if you're severely allergic to dust mites, you have major problems. I mean, if you're allergic to cats, you can just not own a cat. Mm-hmm. You can't choose to not own dust. I mean, they're going to be there. And I've seen some of the people with the worst eczema and the worst just itching. They want to claw their skin apart from mite allergies.
Yeah.
So when I made my own LDI mixtures, I actually have a mixture of mites that's got 18 different kinds of mites in it, because I've found kids and adults alike who become sensitive to the dust mites in the air, and they begin to cross-react with all of these endemic mites that live normally on human skin. Because there's a bunch of them that live on us naturally that are not the same species that we get in dust. Mm-hmm. And so once that happens, that shift happens, you feel like you got to rip your skin off all day long. You were living on antihistamines. And so it works really, really well for that. You get lots of kids with chronic sinusitis symptoms, asthma symptoms, chronic, stuffy nose, eczema, like just all kinds of chronic allergic seeming illness. And you can eradicate almost all of it with this technique without a bunch of drugs and without a whole bunch of testing. You don't have to do any testing at all, as a matter of fact. And you don't have to go in and do allergy shots twice a week that run the risk of causing anaphylaxis and death. That's an important thing to mention too, is that conventional allergy shots are at such a strong concentration that you can kill somebody with those things. You can actually elicit a massive immune response to the shot itself.
Yeah.
With LDI, that is not possible. It's literally not possible. All you're going to do is alter the way the person reacts to the antigen. So if we give a kid a dose for peanuts that's too strong, they won't have a reaction to the dose that they took at all. But the next time they eat peanuts, the way they react to it will be worse. So it requires the exposure still. And that's one of the reasons that LDI is a lot safer than the conventional immunotherapy approach.
Oh, yeah. Wonderful. Okay. So, and then you mentioned using it for your son who was sort of looking like he was on the spectrum for autism. So, and you said you have an autism mix. But autism, deficiency, toxicity, there's so many different, you don't have an autism mix. What did you use for that? What are you using for autism?
So autism is a multifactorial situation. Yeah. And not just in terms of, there might be heavy metals, there might be nutrients, activation problems, there might be this or that. There's not just that, but even when it comes to immune response issues and antigenic reactions, it's multifactorial in almost every case, honestly. My son had such a dramatic effect from just the Lyme LDI that's the only one I have to give him. And I think he might still have things that relate to others, but the average kid on the autism spectrum that I work with probably needs 3 different antigens to cover all of their different specific symptoms completely, or at least well enough that we got good results. And those include things like the Lyme mixture. They include parasites. So I have a mixture of intestinal parasites that are a fairly common antigen. It includes strep. And the strep mixture I have has several different species of streptococcus in it, not just the one that causes strep throat. It includes yeast. Yeast is one of the most common, actually. It includes Clostridia, herpes simplex, human herpes virus 6. There's a collection of things that I find fairly commonly have part of the puzzle for a kid on the autism spectrum. It's definitely not a one-off. You know, these kids are complicated usually.
Yeah.
I mean, if we do give a kid one thing and all their problems go away, that's awesome. Makes me look really smart. It's pure luck.
Yeah.
that's
Yeah.
not typical. You know, it's usually a journey through one antigen after another. Let's see where we can find the answers for this kid, because the symptoms all look very similar to one another. It's not easy to guess correctly out front. You just kind of go through the process and try them all.
I was going to ask you that too. So why don't you test?
It doesn't tell you anything of value. That's why.
Can you explain that a little bit? So explain a little more. Expand on that.
Yeah. So let's say you're in and when we're talking about testing, I assume you mean things like antibodies against Epstein-Barr virus, antibodies against mycoplasma, antibody tests. So in that area specifically, this analogy applies. Let's say you're in a big office building, okay? 20-story office building with 1,000 offices in it, and the fire alarm goes off. The fire alarm goes off in every room, right? In the whole building. Does that tell you where the fire is? No. And that's the problem with those kinds of laboratory tests. Because when a kid has an immune response problem, their antibody reactivity to everything is likely to rise in a non-specific manner. And so just because the kid has elevated antibodies to Coxsackie and HHV6 and adenovirus and Borrelia has no bearing on whether any one of those things is responsible for their symptoms. It has zero. And some kids will do the opposite on you. All their stuff is low. So I don't know how many times I've seen somebody who had a negative test for Lyme disease and all their symptoms went away when I gave them the Lyme LDI. It's completely unreliable in every direction. And I mean, I can't emphasize that enough to, any of the families out there with kids that might be watching this. I have just seen so many people that have spent tens of thousands of dollars on laboratory testing, and it answered none of the questions for them. It's far more likely to lead to a bunch of treatment that you don't need and that could be potentially harmful than it is to actually help you. And that's a huge problem. And I understand why doctors want to do that, because we're trained that way. We're like, oh, tests. Here's my suspicion. I do a test that confirms that for me. Okay, that's great. The problem in this regard is that the test does not actually address the question you're asking. The question you're asking is, does mycoplasma cause this person's symptoms? Yeah. That's what you want to know, right? So you run an antibody panel for mycoplasma. They've got elevated IgM and high normal IgG. You're like, oh yeah, you have antibody reactivity to mycoplasma. I guess it does cause your symptoms. No, it doesn't mean that at all. It has no bearing on anything clinical whatsoever. Another big part of the problem is just cross-reactivity. Okay. Like mycoplasma antibodies cross-react with chlamydia antibodies, and Borrelia cross-reacts with Epstein-Barr virus, according to some experts. So what are you even looking at? Yeah. And then people want to talk about like testing for organisms themselves. So you can do DNA PCR tests or really long-term, very high-quality blood cultures, and you can find, oh, this person has Borrelia in their body. That also doesn't mean anything. I would contend that everybody has Borrelia in their body, and that does not constitute an illness. Just like E. coli, we all have that too. That's not an illness. Yeah. And so just because somebody carries an organism, mycoplasma is a pretty ubiquitous organism. Epstein-Barr virus, everybody has Epstein-Barr virus by adulthood, virtually everybody. So just because you can identify the presence of an organism does not mean that organism is responsible for any of their illness symptoms. You have to do something else to validate that theory. Like if you give somebody doxycycline and their symptoms get better, you still don't know that it's Borrelia because doxycycline kills 1,000 different kinds of bacteria, right? Yeah. But if you want to believe it's Borrelia, you'll choose to believe that means it's Borrelia, and it doesn't. So it's just, we have to have a little higher standard for what actual facts are, I think, as doctors. You need to be like, okay, well, this is a suggestion that maybe this is going on. Let's test the theory. And if it doesn't pan out, you need to move on. You shouldn't cling to that belief because the evidence is really, really weak. Yeah. Okay. That's a problem. And that's the ultimate problem with this whole area of testing, is that it really doesn't mean what you think it means. It's not a problem with the test quality. It's a problem with the applicability and the interpretation. It's like your bathroom scale may weigh you down to the gram with a high degree of accuracy. But if you want to know how tall you are, your bathroom scale is no help to you. Mm-hmm. Right? Okay. So that's a big problem. Is the test is not answering the question you have. It's answering a totally different question that isn't relevant. And that's a problem. I mean, I rant about this for an extensive period of time, but I see so many people that they've spent literally $20,000 on laboratory testing, and then they want me to look at it all. And I'm like, I don't want to see that. Yeah. They go, well, what do you mean? I have all these tests. I'm like, yeah, and you're still talking to me anyway, right? So obviously the tests didn't have the answer you were hoping that they would have. Yeah. And that's just case after case after case. It's not useful.
And I think that's quite often a real issue for parents, because the testing can be very, well, like you said, expensive. And not just that, there's a lot of hope involved and a lot of, investment of your attention and your, like, the direction that you go in treatment. Sometimes the test is very invasive, so kids are like poked and prodded and like they hate this process. And again, like you said, it might send people down a whole rabbit hole. And it might not even be, and we know a lot of these tests, like especially for Lyme, they give a lot of false positives, false negatives, so, and then some tests are way better than others. I mean, there are a couple of labs I really respect, but then again, is that pathogen causing that particular set of symptoms? So we don't really even know if it's a causative factor. It could be there, but, right, so I'm totally with you, Ty. So my question is then, do you have any tests that you would actually do, like you do see are relevant, that are helpful in figuring out this whole puzzle when you have someone show up with like autism or ADHD? It's something that, autoimmune response.
Nothing's 100%.
Yeah.
Yeah, there's really nothing you can hang your hat on that's like, oh, that's always useful. Like in the pandas kids, you'd like to say that, oh, if they have an elevated ASO above 500, they're going to respond to the strep LDI. That's not true. Mm-hmm. Because it's not that odd to see a kid with an ASO that's really high, because half their class just had strep last week. Yeah. So it doesn't mean that. And you can see kids that have a normal strep antibody profile, and then they react to the strep LDI amazingly. Yeah. And it's probably because that they actually became cross-reactive to a different species of strep that lives endemically in the throat. And it's not strep pyogenes anymore that's causing their perpetual symptoms, right? So you're looking at strep pyogenes specific antibodies, and those don't have the answer for you. Okay. I guess, like in terms of the Lyme disease world, if somebody has a really low CD57 count, that particular natural killer cell profile, if those are below 50 or so, there's a really good chance that some of their symptoms are related to Lyme. Mm-hmm. That's one of the more useful blood tests, sad as it is, because it's also not very specific, but it does tend to point to that. So many of the people that have those kinds of chronic illnesses are multifactorial though too. Yeah. And it's like, well, the Lyme LDI might get rid of half of their symptoms and maybe partially improve a few others, but then there's some that are persistent. And so what it really comes down to with LDI is like, I can spend 24 hours interviewing you and get every little bit of minute detail, and I'm still going to end up with a list of 5 possible suspects. Mm-hmm. I'm not going to be like, that's the one, and have any real high level of confidence in that, because these things are too complicated. So what it always comes down to is, I think these things, maybe a few things, seem the most likely. Let's pick one and run through the doses and see what does and does not happen with it. And that's just the process. That's how it has to work at this point in time. And that's how I figure things out. And people are always like, especially doctors, like, well, how do you figure out what to do if you don't run tests? Yeah. I go, well, we all went to medical school, right? And we're supposed to talk to people. So that's what I do. It's like, you're supposed to ask questions. It's all based on the history, So if you tell me that if you give me a child who has like fatigue and lethargy, and they complain about joint and bone pain, and they don't like light, and they have brain fog and they can't focus, be like, okay, that kid might be reactive to foods. They might be reactive to yeast. They might be reactive to Borrelia. They might be reactive to intestinal parasites. There's a list of things, right? So then what I want to know is, what have you tried? Okay. The other big piece of information that's often helpful is, what kinds of treatments did you try, and did they do anything? Yeah. So if you give that kid and they go, well, we gave him antibiotics because somebody thought he had Lyme, and he got worse.
Mm-hmm.
Like, okay, I want to know exactly when he got worse and what the story was of getting worse. Like, did he have an immediate exacerbation of symptoms the day after he started antibiotics, and you stayed on the antibiotics anyway, and then by a week, his Herx reaction had gone away and he started to feel better? Because then that's a picture that suggests that the bacteria is the antigen. Mm-hmm. But if you tell me, well, he seemed fine for the first few days, and then he just kind of started to get gradually worse and worse and worse from then on, that's usually a kid that's sensitive to yeast, not bacteria. Mm-hmm. Because there's a delay, right? So after you're on antibiotics for a few days, you get this increase in yeast population. That's when your symptoms get worse. And it doesn't go away after just a week or so, like a typical Herx reaction does. Usually come out of the woods within a week with a Herx reaction. So a negative response to antibiotics could either be a person that's sensitive to yeast or bacteria. And it really depends on the minute details of their story. So that's what I go through with people. Like, I talk to people for an hour, usually the first interview, and I go through all of these really minute details of the story that most of us just don't think to ask. Most practitioners don't think to ask. They take like a simple answer to a question at face value, and we make a lot of assumptions about what we think it means without really following it through to its logical conclusion.
Yeah.
So that's how I figure stuff out.
Yeah. So
lots of talky.
Which antigen to use, as you get a really good health history, and so you need someone who's trained by you to actually know how to do that, to get ask the proper questions, get the right answers. Yeah,
that would help. And that's something we don't really have built into our training yet. We what my wife and I would like to do is start offering intensive, like maybe 3 to 5 day training things here in Kona. Everybody wants to come here, right? So like have like a 5 half-day sort of thing. Come to Kona for a week, turn it into a paid a write-off vacation, and do like 5 half days where we actually interview patients together, like your patients. Like, you set up one of your difficult cases that I can talk to by Zoom, and everyone can be there, because learning how to ask questions is one of the most fundamentally important things in medicine. And what I've found using this technique effectively is it comes down to asking the right questions and not running a bunch of tests. Yeah. But doctors have gotten real lazy, to be honest with you. We've gotten real lazy in the last 30 years. We ask a short number of questions because I've got 15 minutes to spend with my patient, and then I send them for $10,000 worth of testing. Yeah. And I think that's going to tell me the answer, and that's very ineffective. So we have to flip that the other way. We got to spend more time asking questions. And so the more you can learn to follow the thought process and follow the logic, and when you're thinking about the person's illness exclusively in the context of immune response, the way you ask questions is very different. Like, what you're looking for in your answers is different. Yeah. And so that's what we need to really start training doctors about more. Have a lot of written information. And when we do lectures now, it's a lot of, hey, if you have these symptoms, this list of antigens might be considerations for you. And it gives you a good start, like how to start applying and using the tool. But it's not, we can do better, I think, in training physicians, other practitioners, how to apply this more successsually.
Yeah, and it seems to me that the approach is a little along the lines of broad spectrum. Like, you have mixes. So, you kind of have like a group that kind of go together. Like, you have a mix for foods. You have a mix for, like, the Lyme mix has many different things in it. So is that kind of what you're doing there?
Yeah, one of the elegant things about what was called EPD originally, and then LDA and LDI, is that you can give people antigens they don't need, and it has no effect on them at all. That's a beautiful thing, right? Yeah. So you can't give somebody something and give them a new disease with it, like, that they never had. Like, I could give you a 5C, like a really strong dilution of the Lyme mix, and if you don't have an immune reaction to any of those bugs, it's going to do nothing to you. Okay. That's great, right? So you take advantage of that in certain circumstances when you expect there to be kind of a categorical effect of things. Like, if you have a child with eczema and you have no idea what foods might be contributing to it, because let's say it's a kid that's allergic to 20 different foods. Yeah. Unless the parents have happened to eliminate all 20 of them, the kid's never had clear skin. and they don't know what they're reactive to. So you give the kid a mixture of 200 different food antigens, and their eczema goes away. I had two of my older children, when I first started doing LDA back in 2008, two of my kids had eczema. Their kids are now 22 and 20 years old. They're adults now. They had eczema, and I couldn't figure out what they were reacting to. I ran all the food IgG tests and all that stuff and tormented the blood draws, right? And tried all these elimination diets, and their skin didn't clear up. The first dose I gave them with the LDA mixture for foods, their skin was clear in a week. So, and what you're left with is that you still don't know what foods they're allergic to. Yeah. But you know what? It doesn't matter anymore. It doesn't matter, because you're promoting immune tolerance to all these foods at once, and it fixed the problem, and you don't care anymore what foods they were, because now the kid can eat whatever they want. The other really elegant thing about using a broad mixture in that regard is that it prevents the development of new allergies. So if we were to just say, oh, peanuts and milk and corn, and give you those three things, next year the kid could become allergic to sweet potatoes and carrots and chicken. And now you have to figure that out and devise a specific treatment for that. But when you use a broad mixture in a categorical way, you just literally don't see new allergies developing anymore. So like the environmental mixture, I have 100 different kinds of tree pollens, about 50 types of mold, about 100 different kinds of animals. There's all these things in there together, and you just eliminate their future development of allergies within that category. That's one of the major benefits.
Okay, so I'm going to ask you one more question. Yes. I just want to ask you one more question about, because I keep coming back to this idea that this is like a lifelong thing, and you said that the immune system has a very long memory, that kind of thing. Have you ever seen like where, you just you do a dose, and then you do a dose, and you do a dose, and then it just kind of just goes away for good because the immune system actually isn't going to be reactive anymore naturally? Like, do you see that happen?
Yeah, and that's a lot more likely to happen for children. Yeah. It's not unusual that you get a story, like let's say you're working with an adult, a young adult, and you say, do you have any food allergies? And they go, oh, well, when I was a kid, I was horribly allergic to milk and strawberries, and they gave me all these problems, but now I can eat them and there's no problem. I outgrew my allergies. That's a very common sort of thing people will tell you about. So it's more likely that if we start treating children who have a more adaptable immune system too, like their immune systems are not as stubborn as yours and mine. I'm in my mid 40s, and my immune system, if it hates something, it's probably going to keep hating that thing like till I die. But if you get a 5-year-old, there's a higher level of success with long-term cure, if you want to use the word. But what's more typical, what we tell people to expect and to hope for, is that the reminder doses for the immune system get further and further apart over time. That's very, very common. So at first, when you find the effective dose for whatever antigen you're using, you keep giving it to the person every 7 weeks. That's how long it takes for the immune system to recycle your regulatory T lymphocytes. You have a whole new batch of them. You can retrain the immune system with a new batch of immune cells. That's what we think is going on anyway. So you can do that every 7 weeks until the symptoms you're dealing with are gone, 100% gone for that whole 7-week period. And then we just give the parents or the person their next dose and say, take it whenever your symptoms come back. And that way they can kind of gradually, passively space it out. And they'll find that, the kid could go 8 weeks between doses, and then 10 weeks between doses, and then 4 months between doses. And so eventually, you hope that you only need to take the dose a couple of times a year or even less. Some people with Lyme disease who only need their dose once a year. They start to get fatigue and muscle pain, like, oh yeah, I remember what this felt like, and then they take their dose and it goes away again for another year. That's pretty easy to do.
I totally lied. I said it was one more question, but it's not true. I have another question. Okay, so, but we better wrap up soon because I'm keeping you quite a long time. But I do about okay, so let's say there are lots of people that actually recover from Lyme without doing LDI. Right? They actually don't have the symptoms anymore. They say, I've recovered. I'm just tip-top healthy. So what happened there? Then if they recovered using these other things like herbals and knocking down infection and all those different things that people do for, getting rid of, or, this whole idea that they have a Lyme infection. So what do you say to that? Ty.
Well, what you mean? How can I explain that happens?
How can you explain that they're getting better without without this concept of this reactivity, right? Like quelling the reactivity.
Well, we have this long-held belief, the ingrained belief in naturopathic medicine, basically, is that if you make the person healthy, their diseases will go away.
Yeah.
Right? That's like the basic fundamental concept of naturopathic holistic medicine is, well, we're not going to address your disease head on. We're just going to make you really, really healthy, and then your disease will give up and go away. And sometimes that works. So sometimes when people do all that other stuff and they get to a place in their life where they're emotionally and spiritually much happier, and their nutrition is better, they've gotten a lot of toxins out of their body, on and on and on, their immune system normalizes its behavior. That does work sometimes. And sometimes, like with the antibiotic thing with Lyme disease, sometimes keeping the level of the organism suppressed below your threshold of reactivity for a long enough period of time, like a year, 10 years, whatever, the immune system will in fact forget that it ever had a problem with that antigen. And then you come off antibiotics and you're still fine. And that's why you do see, I don't know, a 10 to 20% pretty significant success rate with antibiotics in Lyme disease. So these things can work. And then there's just the whole phenomenon of it just went away. We don't know why. We rely on that a lot in allopathic medicine training. Let's just hope this goes away. They will give you symptomatic stuff and just hope it stops happening. And then sometimes things do for whatever reason that we don't understand. So, and that's the other reason, like if we do have somebody on LDI and it seems to be working, I encourage them to wait until their symptoms return and then take their dose. They could just keep taking their doses every 7 or 8 weeks forever and never let it ride, never wait to see if their symptoms ever come back.
Yeah.
But then you're going to keep taking doses forever and you might not even need them, right? So if you don't do that delay, let's wait and see and take it when the symptoms show back up, you won't realize you've been cured or whatever. You won't realize that your immune problem went into long-term remission because you keep taking the dose. So I usually encourage that. And we do see people say, oh yeah, I didn't need it anymore. Like some of my patients that just don't contact me anymore, maybe some of them, their problems went away and they just are off living their life and decided not to tell me. I don't know. But some others have told me. Yeah. Others have told me. So I do know that it happens. I mean, in fact, a man that I treated in Alaska when I had my clinic up there who had one of the worst situations of yeast reactivity I've seen in anybody. He had like chronic esophageal candidiasis falling apart. The guy lost 60 pounds, all his muscle mass, fatigue. He had chronic muscle and body pain. And I would give him diflucan for 2 weeks at a time and he'd feel better, but then immediately relapse. And so he was one of the first people I ever treated with LDI using yeast, actually. I only had to give this guy like 3 doses and his problem went away forever. I saw him again like 5 years later. He came back and he was fine. And I asked him, like, whatever happened with that? I was like, oh, it just went away. I was like, that would have been nice to know, dude. I would have really liked to know that. You didn't bother telling me.
Yeah. And so this is why I think like the whole multi-pronged approach is so useful because LDI, but at the same time, you're fixing the terrain, right? So then you have more of a long-term healing that, you don't have to keep doing it. So because you're fixing all of the other garbage that's going on. Like, so I never say like, okay, go ahead and eat McDonald's, but just do LDI to make sure you're not getting toxic with glyphosate. Like, no, like you get rid of the glyphosate too. You stop injecting that stuff, right? Like you don't do that. But so I think that it's amazing if you work with both, those sort of naturopathic, holistic kind of concepts, and also, use this as a tool to, I don't know, I keep saying retrain the immune system. I don't know if that's the right terminology. Yeah, retraining.
That's exactly. Yep, it is. It really is. It's a retraining because the immune system has lost its way, basically. It started reacting to something that's totally harmless and it doesn't need to be reacting. So it is a reprogramming or a retraining of the immune system. I tell people, we're in the social media generation. So I'm like, we're just sending your immune system a friend request, basically. Let's get along. It's all fine again, and it's however you want to look at it, that's what works. And all of the other stuff, like you're talking about, getting people to eat right, to avoid toxicity, to take, herbs that nourish the adrenal glands, to keep heavy metals down, all this other stuff we do. If nothing else, I think it dramatically reduces that person's chance of getting sick again or developing new problems in the future, right? So even if it doesn't eradicate whatever their chronic inflammatory situation is now, which in many cases it doesn't, otherwise I wouldn't have a job, right? Like most of the people that contact me, they've done all that stuff and it didn't work entirely. So then if we can flip off the immunological switches, then they do great.
Yeah.
And I think all that stuff that they did improved their chances of success, I think, because their body's healthier, their immune system is more apt to respond appropriately. And I think it reduces their odds of developing some other new bad thing that might even be worse in the future. So all of it has a role. Yeah. I mean, I don't tell people, you don't need to do any of that other stuff. Like, hey, it's good for you. It's healthy, but there's also a realistic aspect to what we do in integrative medicine. It's like taking 30 supplements a day that cost you $800 a month isn't necessarily what everybody can sustain. So if you can, solve the ongoing problem successfully with other tools and then maybe not have to do everything, that would be great too.
Yeah, simplify, right? Just make it a lot simpler. And there are ways to do that for all across the board. So thanks so much for this interview. This was amazing. And is there where can people find you to learn more and, find you in some of your YouTube videos or that kind of thing?
Yeah. I mean, if people look up if you Google my name, apparently you find all kinds of stuff, which I don't do. I don't Google myself. One of my teenagers told me I'm Googleable now, which is a weird word. We made it as a society. So you can look up Vincent, MD, but our business name, we have a website, and it's called Global Immunotherapy. It's like global, because we treat people all over the world. And what we do is sort of like immunotherapy. So if you look up that, you'll get our website. But you can search Vincent LDI on YouTube. Yeah. And what we tell people to do, even people that contact us and say, hey, I want to know more, I'm interested, we send people to the YouTube videos because you can watch that on your own time. There's no like sales pitch. We don't sales pitch anybody. Just like, hey, research, look this up, learn about it, see if you think it resonates with you regarding whatever problem you have or your kids have, and see if it makes sense before you even contact us. That way there's like, you're not wasting your time talking to us if you don't need to. And that's been really, really useful. The YouTube videos are the best thing to send people to. And then there's a Facebook page. So if you go to the Global Immunotherapy Facebook page, you get to see lots of people's comments for what it's worth. The internet is riddled with people that are high on negativity and low on positivity. So you get what you get, right? Because the people that get better, they usually don't spend a lot of time telling everybody how great they feel on Facebook. They go live their lives. It's overrepresented by people who don't feel well.
Yes,
it just is. Because they've got all day to share their woes with you. So be careful what you find on there. But the YouTube videos are good. There are a lot of online forums in this or that organization, like the corn allergy group. They found me, and a lot of them work with me now because I have a high degree of success with them, and nobody else was able to help them. I've spoken at the autism meetings at TACA and things like that. And so there's information here and there in different avenues, but the YouTube videos are the best thing to look at first and then go from there if it makes any sense to you at all.
Perfect. That's awesome. There's like a gold mine there. So yeah, there's a lot of reading, listening to do if people do that. So thanks so much, Dr. Vincent, for being part of the Children's Health Summit 4 and spending this time with us and educating us about a tool that's probably new to everybody on this summit, because it's something that's very innovative and it just hasn't really been in the mainstream, but I think it should be. So thanks so much for educating us about that. And I think that people are going to get a lot of really good information out of this.
Great. Hey, I'm happy. I have a big passion for children. I have 9 of them myself. Every one of them is on LDI for something. I don't think any of them qualify as normal. So, children's chronic illness in kids is something that we are very passionate about, and I'm really happy to offer something else for people to think about that might help their kids.
Perfect. Thank you. I hope you enjoyed this interview, and be sure to listen to more interviews from this timely and groundbreaking series. If you would like more information, guidance, and support through your family's health journey, and or want to join our growing community of professionally trained family health coaches, please visit us at healthyfamilyformula.com. Together, we can turn the tide for the future health of our children. May you and your families be well.